So we wrote some songs together, and Cleo was 5. It was the first time that I had ever written with a 5-year-old. We wrote this song because we wanted to get outside, and we were stuck inside. So we made up our song so that we could go outside with our words. I'm ALASTAIR MOOCK. I'm a musician, but my relationship with hospitals started with my daughter, who had leukemia, ALL, diagnosis when she was 5. We started writing songs in the hospital together that became an album, and singing songs that we had written that are kind of specific about what it's like to be in a hospital and around doctors and all that stuff. When I get bald, there I'll be. Working with somebody like KIRSTEN, who's a music therapist, that combination, I think, makes this go to another level because she knows the backgrounds of kids and she also understands music as an actual therapeutic process. When I get bald, I won't be shy.
So with music therapy, I'm part of the medical team. I'm working alongside the other interdisciplinary team members, and I have very specific goals that I'm working on with the children. It can be physical, communication, social, emotional, even spiritual support. So we're using the rhythm, the melody, the harmony of music, the motivation of music to help improve their ability to cope and their actual outcomes.
It's remarkably emotional. I mean, I get just a touch of backstory for some of the patients that I'm going in to see. And, you know, for some, there's the elation knowing that they can see the end of treatments and those kinds of things. And for some, there's the dread of, I've got to go in for another one in a little bit.
Bringing in our special musical guests brings in this extra layer of talent, this ability that they have, this way that they present their music. And in conjunction with the music therapist, we're able to harness the power of the music and the songwriting and the special talents they have with the therapeutic piece that we bring as therapists.
Such a bright, oh, sunshiny day.